For this evaluation video assignment, we are conducting the AMPS assessment. Morgan is an occupational therapy student who is working with her client Taylor to look at how independently he can function in his home. Taylor is 26 years old and his patient history shows few problem areas. He has not had any major illnesses or diseases, nor extended hospital stays in the past 2 years. Taylor shows signs of vertigo, which is why he was recommended for OT. He would like to work on his ability to do some tasks at home since he lives alone. Action.
Hey Taylor, how are you feeling today?
Good.
Good. Well, I'm Morgan and I'm going to be your occupational therapy student today. So first I just want to get to know you a little bit, how you're feeling, how you feel moving around your house and everything. So tell me some things that you've been struggling with here at your home.
I get dizzy sometimes. Anytime I bend over or look up too fast or stand up too fast, anything like that.
Okay. So what do you feel like you need to work on? Like, do you feel comfortable in the kitchen? Do you feel comfortable in the bathroom? Or even in your bedroom? Is there any place where you get really nervous because you're worried?
I feel pretty comfortable. It's just, it takes me a while to get everything done because I gotta move slow, so I don't get too dizzy.
Okay. So do you have someone like a caretaker or a family member that are here that can ever help you with anything?
Not really.
Not really? You don't live with anybody?
Mm-hmm.
Okay. So tell me about your home. Like, where is the bedroom? Do you have a bathroom here?
So
What's up?
we're in the kitchen right now, and then there's a bedroom and a bathroom upstairs.
Okay, so it's a 2-floor apartment, right?
Yes.
Okay. So you have to go upstairs to use the bathroom?
Yes.
So do you feel comfortable going up the stairs or not really?
Yes.
You feel
Comfortable.
Okay.
Sorry.
okay. So from kind of what I've gathered, it sounds like you're having trouble like in the kitchen. So some things that I've come up with that we could work on, I'm going to give you a few options and you tell me what you want to do, okay? So I have like trying to get things in and out of a fridge, like a drink or something like that, something we can work on. Sweeping, so like looking down and moving around. We can practice loading or unloading the dishwasher after it's been all cleaned, or folding a basket of laundry, or washing and drying your hands. What 2 of those do you want to work on the most?
Let's do the unloading the dishwasher.
Okay.
And folding the laundry.
Okay. So we'll do those today. So what we're going to do is I'm going to perform just a little assessment. I'm going to watch and see how well you unload the dishwasher and also how well you fold the clothes. We're just going to see how dizzy you get, if it takes really long for you to do it. And yeah, we'll go from there. So this is just a simple assessment. I'll just observe. Don't feel any pressure or anything. Just do it how you normally would do, okay?
Okay.
All right, do you have any questions?
Nope.
All right, awesome.
As Morgan said, the AMP stands for the Assessment of Motor and Process Skills. This is a standardized method of assessing ADLs. When observing the AMPs, an OT should provide 3 to 5 AMPs approved ADLs from which the client will choose 2 that are relevant to their daily life. An OT will observe these tasks and then score the assessment using a computerized data entry program only offered to trained individuals. For this assessment, the examiner must take a course in order to reliably score using the AMPS computerized program. The examiner will observe motor and process skills and insert their findings into this program to generate an AMPS scaled score to indicate their task performance based on their age.
Action.
All right, so since we're already downstairs on the first floor in the kitchen, I want you to unload the dishwasher for me, how you normally would, okay?
Okay.
So go ahead and start whenever you're ready. I'm just going to observe. Need to take a break?
Yeah.
Okay. Good. So is that how you do that?
Yes.
Did you get dizzy? Were you dizzy the whole time?
A little bit.
Okay.
Yeah.
So did you ever feel like you couldn't finish?
No, it just takes a minute for the dizziness to go away. but-
Okay. So normally does it take longer for you to do the dishes than it would, say, if you didn't get dizzy?
Yes. Yes.
Okay. All right. So does that mat ever cause you any problems? Is it slippery? I noticed it was sliding a little bit.
It does slip around, but move around, but not really.
Okay.
I've learned to deal with it.
Okay. And are you normally barefoot in your home, or do you wear any kind of shoes or any kind of socks?
I'm normally barefoot.
Okay. All right. So I guess we can move on to folding laundry. So where do you normally do that?
Upstairs.
Upstairs. Okay. So we can go upstairs and we'll fold your laundry. All right.
Sounds good.
Alright, so what I want you to do is just fold your laundry how you normally would, and I'm just gonna observe, okay?
Okay. So I usually dump it out. Woo. And then
Do you get dizzy looking down?
Yeah.
Okay. All right. So would it normally take you that long if you were not dizzy, or would it take shorter?
Short.
Okay.
I have to take a rest every
Okay.
time I get
So
dizzy.
do you ever have to sit down on the bed to take a break, or do you normally stand up the whole time?
Most of the time I am standing,
Okay.
but there are some times I have to sit down and take a break.
Okay. And so normally do you have one load of laundry to do, or do you do multiple loads of laundry?
Multiple loads.
Okay. All right. So, thank you for doing that assessment with me. I know it's kind of weird doing things that you would normally do in your own house, but having like someone watch you. So, thank you for doing it. I just want to ask a few more questions before we finish. So, just tell me how today normally ranks out of your good days and your bad days. So, was today a good day or was it a bad day?
Today was a pretty good day.
Okay, so it can get worse than today.
Yes.
Okay. Is there any like time of day that it normally gets worse, morning or afternoon?
Usually at night it gets worse.
Okay. So do you have someone that can come and maybe help you during that time?
I have some friends that have offered to help, but I always feel bad taking them up on it.
Gotcha. Okay. So does it happen in certain times of the year, like when it gets hot outside, or maybe when it gets cold?
I've noticed it's worse in the winter.
Okay. So I have all of my data here. Thank you for doing it with me again. So what I'm going to do is I have to put this into like a computer system, and it's going to tell me some different results. So now I know where we are starting and how we can make living here easier for you to do. So, you have any questions before you finish?
Nope.
No?
I don't think so.
All right. Thank you so much.
Thank you.
After observations, the examiner should rate the person's quality of performance on this task. The following are rated on a scale of 1 to 6. Increased effort, decreased efficiency, decreased safety, and assistance provided. 1 indicates no problem. 2 means questionable performance. 3 signifies minimal performance. 4 indicates moderate quality of performance. 5 means marked or significant performance, and 6 means inordinate or cannot be tested. The AMPS motor and process skills are scored on a range of 1 to 4. 4 indicates readily and consistently competent when performing the ADL skill. 3 means questionable for a problem that impacts the ADL skill task performance. 2 indicates having effective performance of the ADL skill, and 1 signifies having severe deficits in the ADL skill performance. This concludes the AMPS assessment tool presentation. Thank you for watching. This concludes our AMPS presentation. The assessment of motor and process skills has high level of reliability because of the training protocol for this assessment. Because of our lack of training and access to this computerized program, we do not have the ability to access the scaled scores for our participant. Thank you for watching.